Hello, all, and welcome again to the Digital Health and Wearables series. Today, we have another fantastic episode for you. But before I go ahead, I'd like to acknowledge our global partners, Spirit Digital. Please check them out and other supporters. But today, I'm very privileged and excited to introduce you to Dr. John Whyte, which is the Chief Medical Officer of WebMD. John, how are you?
I'm doing well. How are you doing today?
I'm good. I'm good. Besides all the situation that we live in, I'm healthy and I'm okay. First of
Good.
all, thank you so much for taking time. I know you always busy, but you've been probably extra busy, should I say, right now, doing lots of different things in the press and with your
Mhm.
responsibility. So thank you so much for taking time out
Sure.
your busy schedule.
Delighted to be with you.
Brilliant. John, the first question that I have for you is how do you think, what do you think actually the healthcare industry needs in order to be more impactful and effective to people?
Where I think the healthcare system has failed patients is around the idea of what many people call patient centricity. The physician has always been the focus, the patient hasn't. So, what we see is there's really no customer service in a way. You try to get a hold of your doctor during the day, it's nearly impossible. It's hard to get appointment to specialists. We have to fill out all this paper. There's concerns about privacy of data, so it's a real challenge, and I think that's why we're seeing a trend towards more consumerization of healthcare is meeting more retail, kind of this DIY approach that you've talked about. So that has been one of the biggest challenges of healthcare. I mean, sometimes we say healthcare is great in the United States if you have it and you have access to it, you get great care
Mm.
if you're well insured. But if you're not, then there's significant challenges. And we do know, as COVID has shined a light on it, the disparities that still persist, often based on the color of one's skin, one's sex, and one's zip code. Since when are we talking about it? It's more important, your zip code than your genetic code. That's not how it should be, in 2021.
John, thank you for that. And the second question, moving on, tell me
Yeah.
a bit. I know about WebMD, and
Mhm,
you are one of the largest providers worldwide
mhm,
of health
mhm.
information. But before the second question, tell me a bit about your work with the WebMD and what you actually do in all its essence of the word, please.
Sure. And as you point out, WebMD is very popular. 1 in 4 Americans come to it every month. We get 80 million page views. Uh, Actually 80 million visitors a month, more page views. So my work as the chief medical officer is really also thinking about how do we extend our brand? How do we promote thought leadership? Do we create editorial around these important health issues that are around, access to care, around, innovations, not necessarily specific disease states all the time, but also about the broader issues of health and wellness that matter to consumers. And how do we do it in a way that we know is credible, is accurate, that is in a language that people can understand?
Oh, fantastic. Thank you, John. And moving on ties in nicely to the question, where do you see technology being leveraged the most amongst in the hands of clinicians and doctors or consumers and patients?
And as you know, it's a continuum. So it's not necessarily one or the other, but where I think we're going to see a trend is towards more and more technology and digital tools in the hands of consumers, in the hands of patients. I mean, we all have that smartwatch. We all have wearables, which we're going to see improved technology, as we're already seeing in terms of our clothes, our pajamas are the next wearables, more trackers and sensors. And that's because back to this idea of patient centricity, the consumer is going to be more in charge. They're focused on connectivity, they're focused on cost, they're focused on convenience. So when people search content, joint pain, diabetes, they want to get care right away. They want to connect that content to care. Why should you have to wait many weeks to get an appointment at the dermatologist or the GI specialist? So, how do we empower patients with more tools and resources, apps that can help get a read of a mole or lesion, a device to put on your phone to do your own refraction so you can order a pair of glasses? I think we're going to see more and more of this retail in a way where healthcare is meeting retail, where consumers are going to buy products, buy tools to really become more empowered. Sometimes what I call this DIY approach, this do it yourself approach in healthcare. But we can't cut out the doctor, the pharmacist, the other members of the healthcare community. So we have to figure out a way to tie it together, because the trend towards consumerization of healthcare is not going to stop. And that dynamic between, the physician and the patient is changing, and that's a good thing. Whereas the physician always used to be up here and the patient here, and now we're really moving it more towards shared decision making and really having a discussion of therapeutic options, rather than in the past me telling you what you should do and then you either do it or say you're going to do it and ignore it, but nonetheless really empowering you with knowledge. And that's why it's so important to get great content out there and to make sure that it's accurate and people can access it as well.
Oh, fantastic. John, I really like that, the DIY of healthcare. I mean, we talk about that in the healthcare
Mhm.
industry for quite some time, the patient and the consumer taking responsibility going
Yeah.
forward. So I really like that. And you have been very busy with the pandemic, doing
Mhm.
interviews, but also advising people. And the last question is,
Mhm.
what advice would you leave us with in order to stay healthy and sane and
Yeah.
go through the transition with the pandemic?
Mhm. We have an infectious disease pandemic in terms of COVID, but we also have to recognize we have a mental health pandemic that is going to continue post COVID. Lots of people are experiencing loneliness, sadness, PTSD as a result of many of the measures we've had to implement to control the pandemic. So it's really a focus on self-care. We do know, we did our own surveys at WebMD, there have been elsewhere. We call it sometimes the COVID-15. We all have gained weight. I have gained weight over this time. We're all sitting way too much. And we really have to start to focus on self-care. Let's be honest, there is a mind-body connection that we have ignored for too long. And there is no physical health without mental health. They're tied together. So we really need to focus on self-care. One of the biggest changes that we need to make, and we could start making it very soon, is sleep. We always tend to say, well, we'll do that on the weekends when we catch up. Well, there is no sleep bank to catch up. So we really need to focus on getting that quality restorative sleep of 7 to 8 hours. We need to try to be physically active. I have a friend whose lights go off every 30 minutes. So when he's on Zoom calls, he knows to get up and move. And sometimes when I'm talking to him, he's moving around. But that's a good thing. We all need to do more of that. We need to focus on healthy eating. I've been eating a lot of sweets and eating them late at night. I know that's bad, and we need to make that effort. But I'd also say let's not be too hard on ourselves either right now. There's a lot going on in the world and in our families and in our communities, and we need to make small changes over time. This is a journey that you don't want to just say, well, I'm going to lose 10 pounds over the next month. It's about, where do you want to be a year from now? Where do you want to be 5 years from now, 10 years from now? And how do you make those changes to get to that point?
Mm. John, fantastic. We could talk for hours, to be honest with you. Very interesting, fascinating conversation. I finish off all my episodes with which is a surprise for you because
Mhm.
you're not expecting this, with a
No.
1 minute of fame, which it can be anything whatsoever. It could be a personal achievement, a professional achievement. You talk about
Mhm.
family, colleagues, anything
Mhm.
whatsoever. John, before I wrap up, so over to you. 1 minute of fame.
So 1 minute of fun. What I'd
Fame,
say,
fame, fame,
1 minute of
fame, fame. Yeah, it's called 1 minute of fame. Fame.
So I could talk about anything?
You can talk about anything whatsoever.
What I would say is, I always like to be positive. And one of the things that I will take from the pandemic is the opportunity to be at home with my family, my wife, and my two young sons. So I did travel a lot in all of my jobs prior to the pandemic. And it's been so great when I think about I've had like 700 meals together over the past year. Usually not lunch because they're usually doing their virtual school and I'm on a Zoom not eating lunch, very bad. But we almost always, 99% of the time, have breakfast and dinner together. And that's not something that we did during the, prior to the pandemic. So in some ways, that's been a blessing that I've had, and to really spend this time, particularly with young children, because as we all know, they grow up very fast. And I feel that my two young sons actually have become closer together because they've spent so much time together. So that would be my point about, something that's been positive from the pandemic, despite all the challenges that we've had.
Well, that's fantastic. A really highlight in the other side, a very contrast side, because I know you're
Mhm.
very busy professionally. John, thank you so much for your time. It's
No, absolutely. And thank you for raising these issues, for, providing the thought leadership that we're talking about around digital tools, digital health, how the healthcare system is changing. We need to be having more of these discussions. So always happy to chat again as well.
John, thank you so much. That leads me to thank you again, and thank to our viewers. Please subscribe, share this amazing content, and I'll see you next week. Thank you so much.
Bye bye. Ciao.